Metastatic breast cancer treatments and breakthroughs of 2020. And if today all you did was hold yourself together, I'm proud of you. Are we close to a cure? Every cancer is different, so finding a one size fits all cure is unlikely anytime soon. Breast cancer treatments are always evolving and improving. List of new anti-breast cancer drugs: Enhertu, Nerlynx, Tukisa, Phesgo, Pembrolizumab, Piqray, Talazoparib, Trastuzumab, Atezolizumab. Trodelvy was approved by the Food and Drug Administration in April 2020. It can be used to treat metastatic triple-negative breast cancer that hasn't responded to all at least two other treatments. Triple negative means the cancer cells test negative on three factors. They don't have estrogen or progesterone receptors. They don't they don't overexpress a protein called HER2. This type of breast cancer is difficult to treat. It spreads faster than other types. Trodelvy is an antibody drug conjugate. That means it targets the chemotherapy drug into the cancer cells and helps spare healthy tissue more than traditional chemotherapy. And HER2 is another drug. It has been very effective in treating HER2 positive breast cancer that's metastasized or spread or can't be removed with surgery. Nerlynx is another drug. It was approved by the FDA in July 2017 for early stage breast cancer. It was approved in February 2020 for metastatic cancer in combination with the chemotherapy drug capecitabine. Nerlynx is a tyrosine kinase inhibitor. This is a class of drugs that works by stopping the abnormal cells proliferation in HER2 positive breast cancer cells. Tukisa is another drug. It was approved by the FDA in April 2020 to be used in combination with the chemotherapy drug trastuzumab and capecitabine. This drug is a tyrosine kinase inhibitor. It blocks an area of HER2 gene in cancer cells, stopping the cells from growing and spreading. It's intended for adults with advanced metastatic HER2 positive breast cancer, including cancer that spread to the brain and is difficult to treat. Phesgo is another drug. This combination injection of pertuzumab, trastuzumab, and hyaluronidase GCA-XF was approved by the FDA in June 2020. It works by the binding to HER2 sites and stopping cancer cells to grow. Pembrolizumab is another one already approved by the FDA to treat many types of cancers that have a large number of gene mutations in the cancer cells. Pembrolizumab has been studied for the treatment of metastatic triple-negative breast cancer. Pembrolizumab is a checkpoint inhibitor. It works by helping your immune system attack cancer cells. Piqray is another one. Was approved by FDA in May 2019. It can be used in combination with fulvestrant to treat postmenopausal people with hormone receptor positive, HER2 negative, advanced or metastatic breast cancer. Alpelisib is a phosphatidyl inositol 3 kinase inhibitor. It impedes the growth of tumor cells. This treatment only works for people with PIK3CA gene mutation. Therefore, you must first take an FDA-approved test to find out whether you have this specific mutation. Talazoparib is another one approved by FDA in October 2018. Talazoparib is approved to treat locally advanced or metastatic HER2-negative breast cancer in people with BRCA1 or BRCA2 mutation. Trastuzumab with hyaluronidase is another one, has been used so many years to treat breast cancer. In June 2020, the FDA approved a new formulation of trastuzumab that combines the medication with hyaluronidase. Hyaluronidase is an enzyme that helps your body use trastuzumab. Atezolizumab is another one. In March 2019, the FDA approved atezolizumab, a new type of drug, as a PD-L1 inhibitor. Atezolizumab is approved for people with locally advanced or metastatic triple-negative breast cancer that cannot be removed surgically, whose tumors express a protein called PD-L1. Treatment for breast cancer depends on the stage of the cancer and several other factors like age, genetic mutation, status, and medical history. Most cases of breast cancer need a combination of 2 or more treatments. Here are some of the available treatments. Surgery to remove the cancer cells in your breast or to remove the entire breast. Radiation, which uses high-energy X-ray beams to stop the spread of the cancer. Oral hormone treatments such as tamoxifen and aromatase inhibitors. Trastuzumab is the breast cancer test positive for excessive HER2 proteins. Other treatments are HER2-targeted therapies such as pertuzumab or adult trastuzumab, emantacine, neratinib. Newer drugs called CDK4/6 inhibitors that are approved to treat HER2-positive, HER2-negative metastatic breast cancer. They include palbociclib, ribociclib, and abemaciclib. Other drugs used to treat are tyrosine kinase inhibitors that treat HER2-positive metastatic breast cancer, including neratinib, dapatinib, and tocatinib. PARP inhibitors, which are only for people with HER2-negative metastatic breast cancers and who have a BRCA1 or BRCA2 genetic mutation. Zoledronic acid, and denosumab are also drugs that can help prevent skeletal-related events such as fractures and spinal cord compression for breast cancer that spread to the bones. Your healthcare providers always look and hope for the quality of life for their cancer patients. While living with metastatic breast cancer, there are always ways to help improve your physical, emotional, and financial well-being. Talk with your healthcare provider about managing pain and any side effects from your treatment, such as nausea or feeling fatigue, as well as other potential issues like sexual health and fertility. If you are experiencing depression or anxiety, see a therapist or a counselor, or join a breast cancer support group. Your healthcare provider may have recommendations. For help covering the cost of your treatment, talk with a financial counselor about assistance programs. These breakthrough therapies are much safer and more effective. They may be able to replace harsher treatments like chemotherapy. This means that a person's quality of life during cancer treatment will also improve. Quality of life, happy life, and full of hope for our cancer patients. Research done by Dr. Ray J. Libakin. And if you are new to this channel, please subscribe and push the notification bell to further learn and know more about breast cancer if there are new topics. Thank you.